gentlemen, and welcome to another edition of the program You and Health, aired on Equinoxe Radio Multimedia. And for presentation, I am Esia Lucy Liengu. Women worldwide are affected by uterine fibroids, a condition where most women experience prolonged and heavy periods. Today, we'll explore the challenges posed by uterine fibroids, the causes and risk factors. And with me here in the studio is a general practitioner. But before we unveil our guests for the day, with whom we'll be discussing the challenges faced by most women with uterine fibroids, next to me is my co-host for the day, Immaculate Foge. Good afternoon.
Good afternoon, Lucy. Good afternoon, Doctor. Good afternoon to all our televiewers.
It's a pleasure always having you on the program.
Same shared.
Yeah, and next to me, on my right-hand side, is Dr. MUNOH E ARRENEKE. She is a generalist, of course, from the Bingo Baptist Hospital here in the city of Douala. Good afternoon, Doctor.
Good afternoon.
A pleasure having you again.
Same here. Thank you.
You're welcome.
Thank you.
And now, before no waste of time, we'll go directly to our questions. Doctor, would like to understand, to a layman's understanding, what is uterine fibroid?
Thank you very much for having me on the program again and for choosing this topic that almost everybody is affected directly or indirectly. So a uterine fibroid is a benign tumor of the womb. Let me use womb. And what we mean by benign is that it's a non-cancerous tumor, and tumor just means growth. So it's a non-cancerous tumor that mostly affects women and particularly found in the womb.
Okay. And how do they develop?
Okay, the pathophysiology or how these tumors developed have not really been understood. The different hypotheses that have been put forth says that they develop from the smooth muscles of the uterus. So the smooth muscles of the uterus grow abnormally than they should grow, and usually they are impacted by the hormones progesterone and estrogen, which explains why this is obviously seen in women and not in men.
Now let's talk about the common symptoms associated to this condition.
Okay, the symptoms associated to uterine fibroid can actually be classified. There are those related to the menstrual cycle and those we call the bulk symptoms. So the bulk symptoms are related to the size of the tumor. If the tumor grows so big, you will have symptoms like bloating. You easily get satisfied when you eat. You hear them complain that my stomach is getting full, I cannot eat again, or frequent urination. If it's so big that remember that the uterus is in the pelvis and the bladder is in the pelvis. So if it's so big and it's compressing on the urinary bladder, you will have them urinating frequently. And most often, they will not associate these symptoms to a fibroid because they think that the symptoms are not related. Another common symptom that they'll present it with is fatigue. Why fatigue? They bleed too much. And because they bleed too much, they tend to be anemic. So they'll come complaining of palpitations. They'll tell you that my heart is beating so fast. I'm getting tired. Most often they'll present with these symptoms, but at the back of it is as a result of anemia. That is because they're having heavy bleeding. So they'll have heavy bleeding, they'll have anemia, and then they'll produce symptoms of anemia. And then they will have bulk symptoms, bloating, frequent urination, getting full very fast. And they also have pain. Usually their pain can be related to menses or not related to menses. So they'll be having very painful menstruations, or they can present with abdominal pain that is not related to their menstruation. And sometimes, depending on where the fibroid is located or on how it has distorted your womb or not, you might also have problems with conception.
Are there different types of uterine fibroids?
Yes, we could say that there are different types, though it's just based on the location. When we talk about the types, it's mainly about the location, since the uterus is like a hollow organ. So based on where this fibroid is located, if it's inside itself where the baby should implant, is inside the wall, the thick wall of the uterus, or is just outside, connected to the abdominal cavity or close to the cervix. So this is how the different types are. So you get intramural, submucosal, subserosal. They are just classified based on the location of the fibroid.
Who is at risk of suffering with this condition?
Oh, that's a very good question. I would say that first, being a black woman increases your risk.
Wow.
That's, I don't mean like the melanin, I mean of African origin. Yes, so it increases your risk. It is said that black women are at a 3 to 4-fold increased risk of developing a uterine fibroid than the white women. But this doesn't mean that it's exclusive for them. They equally have fibroids, but our chances of developing it is high, and this is as a result of multi-factors. It's multifactorial. Another risk factor is early menstruation. It's been noticed since these fibroids they are fed by blood, and they are impacted by estrogen and progesterone. So the women who start menstruating early, say at 10 years, they have higher chances of maybe developing a fibroid in their lifetime than those who menstruate at the normal age of, say, 13 years. Another one is an elderly female who has never put to bed.
Oh.
Because it is said that, don't be scared, I get that.
When you say elderly, that's about how old?
Above 30.
Oh,
30.
okay.
Yes,
Wow.
above 30. So it is said that getting pregnant and carrying the pregnancy for up to 20 weeks reduces your chances of getting a fibroid.
Right.
It is. So going for a long age without getting pregnant kind of puts you at risk. So I think these are some of the risk factors that we have in developing a fibroid, just being a black woman. And then there are also genetic factors.
Okay.
There are genetic factors related to if you have close relatives that have had fibroid, it increases your chances of getting a fibroid than somebody who has no relative who has had a fibroid.
Okay.
Ima, before we go ahead, the contacts for those.
Yeah, for those who like to participate in the program, you are the contact 670-5470-49. I repeat, 670-5470-49 or 656-622222. Those are the numbers that you can call and participate in today's edition of the program.
And now back to you, Doctor. How can these fibroids affect fertility and pregnancy?
Oh, okay. That's another interesting question. There are different ways in which the fibroids affect fertility or pregnancy. But the main way in which it does is the bulk. So if you have a fibroid that is found right in the submucosal, it's found right in your uterine cavity, and is big enough to prevent your baby from implanting. So it affects you. But now we have to keep in mind that infertility issues are usually multifactorial. So before we say that, okay, this infertility is as a result of a fibroid, we must be very certain that we have ruled out all the other causes, because in case where it's just that fibroid, once we take care of the fibroid, the woman can get pregnant. But most often there are other things contributing to the infertility than that. And also, since fibroids come with a bit of an advanced age, because when you look at the prevalence, it increases with age, and it marks around between 40 to 44 years in women. That's where it marks, because after 44 years we are getting towards menopause, and since this is fueled by estrogen and progesterone, in menopause we don't have this hormone, so we tend to have a regress in the prevalence of uterine fibroids. So because it increases with advanced age, and advanced age is already a disadvantage for fertility, because your number of eggs and everything is on the downside. So sometimes we tend to think that this infertility is because of fibroid, which makes it complex. So we cannot really definitely say that this, except that if we have a fibroid that is big enough and is in your uterine cavity, yes, we want to think that is affecting your pregnancy and your fertility. But you also have cases where you can have a fibroid and you go ahead and have a baby and deliver normally. If the fibroid is not in the uterine cavity, if maybe it's an intramural type, it's in the muscle, it's not affecting your uterine cavity, or a subserosal, completely outside and attached just to the surface of the wall, you can go ahead and have your baby without it interfering. Sometimes it's also associated to frequent miscarriages, but it's been difficult to really correlate to tell if this miscarriages is because of advanced age or because of the fibroid. And again, it really depends on where this fibroid is located in your uterus.
Now we want to know, how is the condition diagnosed?
Oh, okay. Thank you very much for that question. Like every other condition, diagnosis begins clinically. So we suspect from the person's presentation in the hospital, and we go ahead to do an imaging study. And the most common and easily accessible imaging study that we do is an ultrasound. You just do a pelvic ultrasound, and it's able to tell you that there's a fibroid in there, which is quite affordable.
Now, let's take a case of a pregnant woman who, let's say she's at the stage of 6 months and she has a uterine fibroid. How do you manage such a case? How is treatment done in such a case?
Okay, generally, if we discover at that point, it will depend on how it's affecting the health of the baby and the mother.
Okay.
So if the baby is not affected, like I said, if it's where the baby's health is not compromised at all, we let the woman deliver, and then we manage the fibroid after delivery.
How can fibroids affect a woman's menstrual cycle and also her overall well-being?
Okay, generally, fibroids leads to heavy bleeding. So when most women who have uterine fibroids, they tend to have heavy menstruation. You see them telling you that before, my menses used to last for 3 days and I could change just 1 to 2 parts per day, but now I go up to 7, 8 parts and I menstruate for 5 to 10 days. Some even menstruate the whole month, which is what causes the anemia. And of course, menstruating the whole month, it affects the woman's life. It's quite uncomfortable that you're bleeding every day. Yes. So, and then the next thing is that when you bleed like that, you get anemic. So it will still affect your health. You become tired, fatigue, palpitations.
So it means that when every girl notices that maybe her menstruation cycle is lasting more than before, they had visit the hospital for test or for diagnosis.
Definitely, I would advise that if you notice that your menses, I'm not saying that every heavy menstrual bleeding is fibroid, but it's important to rule that out because it's one of the major causes of heavy menstrual bleeding.
With this condition, are there some lifestyle changes that we need to consider?
Oh, yes, they are, but their impact or their effect is minimal. Maybe reducing your red meat, losing weight, heavy exercises and consistent exercises. It does affect it, but its effect is minimal, especially if the fibroid has been formed already. So if the fibroid has been formed already, doing all of this will not help it regress. Sometimes what helps the fibroid regress is if you enter menopause. Since it's fed by bleeding, sometimes when you get into menopause, it can regress on its own. But it's advisable that we stay healthy, we diet and we exercise, get the required weights for the required body mass index, the weight according to our height.
And that goes to the question that how does dieting and physical exercises help someone who is suffering from fibroid?
Oh, I wouldn't say dieting and exercise will not directly affect somebody who is suffering from fibroid because it will not make the fibroid to disappear completely. If the fibroid is already there and we have to manage it, and the management is based on the patient's symptoms, the patient's desire to get pregnant. Basically, the management is based on this. It's based on the patient's symptoms and if the patient desire to get pregnant or not.
Now, for someone who has had a fibroid and that fibroid has been removed in a hospital, is there a possibility of another fibroid coming up again?
Yes, it's very possible.
Why?
Well,
was it not well removed or something?
No, since we said that fibroids originate from the smooth muscle of the uterus. So we remove the fibroid, the muscle is still there, the estrogen is still there, the progesterone is still there. So there's a possibility of another fibroid growing. Yes.
And now, when it comes to treatment, is there a possibility of not using drugs to completely eradicate fibroid from the system?
Oh, to flush it out. Yeah,
to flush it out. I like that statement. They always say they want to flush it out. Okay, the management of fibroid is generally classified as medical, surgical, and then we have what we call the the uterine artery embolization, like you kind of block the artery. So these different management options are very personalized. It depends on your case, what you're presenting with. Generally, I would say, and it depends on the symptom you're targeting. Some people come with symptoms of heavy bleeding, and that's what you want to target. Some people come with symptoms of severe pain. Some people come with symptoms of the bulk, maybe bloating, frequent urination, discomfort, their tummy looks. You see patients that look like they're 9 months pregnant, but they're not pregnant. They have a fibroid in there. So all of that is taken into consideration. So the management is highly individualized. But yes, there are medications for fibroid, but not what we have around. It's still very rare. It's not a common practice. The common practice around that is readily available is the surgery to get operated. Now, for the uterine artery embolization, we really prioritize that for women who say, okay, I don't want to get pregnant again. Because if you stop blood flow to the uterus, it means you cannot get pregnant again. If you get pregnant, how will your baby survive and all of that? So that's why I say the management is individualized. You need to know your patient, what they want, what symptom you're targeting. Then you decide if this patient merits a surgery or you want to do medical management. And most often, most of the medical management that is given will interfere with fertility. That's why I say you have to individualize the management. So it really depends on the patient you're targeting. But these are the 3 management options.
Okay. Is this surgery not going to play a negative role when a woman wants to get pregnant later on?
It depends on the size. If the fibroid, because the surgery for fibroid is divided into 2. You have what we call myomectomy and hysterectomy. Myomectomy means we just remove the fibroid and then the womb is intact. Hysterectomy means removing the womb completely. Again, it's individualized. If you have a woman with multiple fibroids and they have distorted the womb and you're not able to remove, there are so many that you cannot remove. The best option for the woman is taking out the entire womb. And now this option also will be based on the patient. Is it a young lady who wants to get pregnant, or an elderly woman who probably maybe has like 3-4 children and is satisfied with it and can let go of the uterus? But sadly, sometimes you have really young women who don't even have children, but the fibroid has so distorted the uterus that it cannot be saved. So it's good to get diagnosed on time. What I will say here is that when you're diagnosed on time, whatever the solution they give you, I think it's best to take it, because most often we delay with it, and remember, it grows. So if we see it today and it's at 5 centimeters and you're delaying with it, you come after 2 years and it's the size of a 6 months baby, and now that reduces the chances of your uterus being saved during the operation.
How much does it cost to carry out such a surgery?
I think that it will be very different because every city in Cameroon has a different price zone.
Well, let's just take an overall. Let's just take an estimate about how much.
And from where I work and what I know,
okay,
maybe you can say 250 to 400,000. You can get it removed.
And that guarantees everything.
Everything to remove, but it doesn't guarantee that it will not reoccur.
Okay.
Yes,
Understood.
yes. Everything to remove what is in place, but we cannot guarantee that you will not have another fibroid. Yes.
Thank you very much, Dr. MUNOH ARRENEKE. She is a general practitioner at the Bingo Baptist Hospital here in the city of Douala. Thank you, Immaculate Fogwe.
Always a pleasure.
Always a pleasure. Sure. And for presentation, I have been a Lucy Liengu. At the technical dashboard, we had